everyone, and welcome. Thank you so much for joining us this evening. It is great to have you here. Tonight, we are going to be talking about all things how to avoid a dental emergency while you're on holidays. So we've got a few people joining us now. Welcome. It is lovely to see you here. And I'd like to introduce to you Dr. Les Jabor, and he is the owner of Define Dental at Benoa in the Gold Coast. Now, we have put on this webinar because we know that we are coming up to the holiday period, and Les, being a very experienced dentist within the area, knows all too well the issues that crop up when you're on holidays. So Les has been kind enough to put on this webinar to make sure that we can give as much advice to you so that you don't fall into the traps of having a dental emergency, a broken tooth, toothache, all of those kinds of things while you're on holiday. We are going to have some questions at the end. We would love for you to ask questions throughout. The presentation will go for about 30 minutes, and then we'll go into some questions. So without further ado, I would love to hand over to Dr. Les Jabor, the owner at Define Dental. How are you, Les?
Good evening, and thank you for such a lovely introduction, Michelle. Yeah, I'm good. Thank you.
The reason why we wanted to put this webinar together is because you've got lots of experience managing lots of patients. You've been on holidays yourself, and have had to be called up as a dentist to try and assist people while they're on holidays. And we know that there's a lot of people that perhaps are going on cruise ships, that perhaps are going overseas, or even just if you're traveling within Australia, the last thing you want to have happen is to have your holidays be in a way disrupted by having a sore tooth, etc. These big cruise ships, they're the holiday of a lifetime. They're amazing to go on, but they don't necessarily have a full dental clinic on board. So we really want to put this on to help our community and provide lots of information before the holiday season. So Les, tell us about how to avoid these dental issues while on holidays.
Okay, so thank you once again. For most of you who know, I have 6 lovely, beautiful children, and most of the time they behave themselves, but occasionally they don't. So I am filming this at home. I did come home from the surgery, so please forgive me if one of them rush in behind me. Now, part of the reason we thought this was a wonderful idea for the webinar because people were requesting information about it. And I've seen and experienced so many issues or complications on just about every angle. While I'm traveling, I've had to help people. In my clinic, I've had to help people. And we've had patients who've traveled overseas, so we've had to help in one way or another, whether it's contacting a dentist that we can know and trust or otherwise. So when I had a chat with Michelle about this, I wanted to make sure that we would create value and some practical tips that you can go away with for just about all of you who are going to be going on holiday at one stage in time or another. So hopefully we can make that holiday that little bit better. I did prepare us. Yes.
Sorry, can I just say something? So often before we go on holidays, we're in the situation where, we check our passports to make sure that's all good. We organise our travel insurance. We go to the GP to see if we need any, travel vaccinations or any medication specifically for the destination that we're going to. We go to the pharmacy, we stock up on supplies, but often we forget this step of going to the dentist prior to going on holidays. And I think that's something that, we'll certainly talk about tonight to make sure that it is just that other thing that we just need to check off our to-do list prior to going to make sure that we have a great holiday.
Without a doubt, prevention is much better than cure. And when we have time to sort things out before you leave, and having time to do that is a crucial element there. It's always better for everybody involved. So yes, let's add that to that to-do list once the holiday's booked and locked in.
Absolutely. So we'll jump into the presentation.
We've got a lovely picture of the well with planes flying around. It's nice to have COVID behind us now, isn't it? Let's go to the next slide, Michelle. So I thought it would be really nice to go through some real life stories with some lessons learned. And part of today's information has literally come from many experiences I've had, and I've kind of conglomerated them to make it short and sweet. What to do when you're on holiday? What lessons can we learn? What should and shouldn't have been done? Things to do to prepare before you go. That's a tongue twister, that one. That's always good to know. Once again, we're talking about prevention being much better than cure. And the dental emergency kit. For those who don't know, I did publish a blog on that maybe a month ago now, and it's got some good information there. But I'll summarize that for you today and give you some additional information there. Now, I've got a picture of a plane and a boat there. The first little story I'd love to share with you is I was traveling overseas. We're on an air flight. I was with my mates at the time, actually, and just reading a book when one of my mates sort of nudged me with his elbow, brought my attention to what the stewardess was saying on the loudspeaker. And sure enough, she was asking if there was a doctor or a dentist on the plane. And he sort of gave me a nudge and said, "You're up, mate. You know, this is your opportunity." So surely enough, I pushed the little button to call the steward, and she came and was grateful that I was willing to help. And we walked up the aisle up to the front of the plane, and there was a gentleman there who was clearly distressed and clearly in pain. And the poor guy had an issue with the tooth. Unfortunately, I didn't pack my dental chair and dental assistant and dental clinic with me. So the best we could do at the time was get him some painkillers. Now, luckily enough, because I had some authority as a registered dentist, and the plane had some stuff on board that we could give this gentleman, we were able to get him out of trouble while he was on that flight. Obviously, when we got to our destination, he had to find a dentist and get things sorted. But that was the real lesson in there for me when I was asking him some of the questions that we would ask as a dentist. Now, one of them is, how long ago did this start and what sort of pain is it? And it was like, well, you know what? It started off as, his reply was, it started off as a niggle. I knew something was going on, but I just didn't have time. I didn't have time to fix it. It was obviously clearly a busy gentleman. You'll notice I put in there, he'd rather be in economy pain-free, because I think I had to walk up to first class to see him. And he made the comment, geez, I'd rather be back there pain-free than up here with this toothache. But nevertheless, we got him out of trouble. He was grateful that we could get him some pain relief. And the big lesson there was not to ignore niggles and aches, and not to be too busy to book your appointment. Because had this gentleman had booked his appointment, that I think he would have had much better traveling experience, both in transit and when he gets there. He wouldn't be wasting any time when he could have done the other stuff he was there to do. So you'll see I've put in there packs of painkillers, and that's one of the items on the dental emergency kit. Not the first, but an important one. The next story, we'll see the little picture of the tour bus on the nice beach there. Isn't that beautiful? We all would love to be there. I walked into work one day and walked past the reception telephone, and sure enough, it was the morning, and the little red light was flickering, knowing that there was a message there. And it was clearly, so I listened to the messages, and there was a lady on the phone, and she was clearly distressed, and she had a tooth that was broken. It was very sharp, and they can be like knives, and it was cutting her tongue, and she just clearly had enough, and she really needed it fixed. She was in pain. Luckily for her, we could get her in that day and look after her. The challenge for her, though, was she had a tour booked, so she had to forego that tour so she could come into the dentist. Now, when she came in, funnily enough, I asked her, it was a filling that had fallen out, and then the tooth had weakened and gotten broken. And she was aware that there was something that wasn't 100%, but she had ignored that. And obviously the lesson there was not to ignore, even if your body is telling you, or you can feel, usually the tongue is the wonderful muscle and can feel everything. If it tells you there's a problem, there probably is. So don't leave it and don't ignore it. Once again, booking in for that dental appointment before she traveled would have saved her that day. Now, another little pointer that I promise you to give you pointers throughout this was what I told her while she was in pain was to get, and it was from the sharp edge of the tooth cutting her tongue. I asked her to get some sugar-free gum and just sort of packed it in and around the tooth. And that gave her some relief until she got to come in. Surely enough, when I saw her, she had a big ulcer from the trauma of that. So luckily for her, she's okay now, and that lesson was learned. That's another real life story. Now, this next one is a patient who is a patient of mine who was traveling overseas. I've got the picture of the Colosseum there because the gentleman was in Italy. I'm sure he was having a wonderful holiday, but he forgot one of his appliances. He wears a what we call an occlusal splint, which is like a grinding guard to help protect the teeth, especially when sleeping or when you know you've got a clenching or a grinding habit. Now, he normally wears it. He's an excellent guy, an excellent patient, but at this time he wasn't able to because he had forgotten it and unfortunately had broken a tooth. Now, the challenge was being in a foreign country, not knowing anybody, and wondering, oh my goodness, this is a big problem, and what are we going to do? Now, the smart thing he did was actually email us, because lucky for him, I knew a dentist who was in a approximate area to where he was, so we could refer him to someone we knew and we could trust, and we were able to get him out of trouble. And the good thing was we could email the x-rays to and fro, get him the best treatment, and then we were ready for him when he came back. We had some appointments and were able to sort everything out for him. And he ended up having a relatively good holiday because those things were sorted for him. So don't forget the appliances. They're very, very important. If we go to the final story now, I could expand on these. We're going to have a question time at the end, but I'm aware it's a weekday evening, and we're trying to make it as informative in as short a time as possible. The last one is I have many stories to tell about people getting dentistry overseas and coming home and it not being up to standard. There was a lady, this particular case, and she had been to Thailand and she had some implants placed in Thailand. And to her dismay, while she was in the airport leaving Thailand, one of them had failed and come loose in her mouth. So she's pulled that out. She didn't want to miss her flight. She's jumped on the plane. And as soon as she's arrived, she's given us a call. And obviously, it's a significant issue. So we got her in ASAP within 24 hours. We make a commitment once we're notified. The only day of the week we close is Sunday, and we make a commitment to see everybody within 24 hours of notifying us. So that's good for all of you out there to know. We were able to see her, we were able to get her out of trouble. Now, it would have been much better for her had the treatment have been done properly the first time. So it was much more complex to redo it, and that makes it more expensive. And the thing that many people fail to contemplate, especially with complex treatment, is it needs maintenance. Nothing lasts forever and everything needs maintenance. And the question, if something is done on a 14-hour plane trip away or an 8-hour plane trip away, whatever it may be, is who is going to maintain that dental work? Who's responsible for any issues? So unfortunately for this lady, she paid someone to do this for her overseas. And then in Australia, that cost was going to have to be re-realised. And sorting these things out, like, are you going to return to that country to have this thing fixed or maintained? And that's a really good question to ask, because if we are going to do it in Australia, there are many, we have a regulative body in Australia called TGA, or Therapeutics Good Administrative Body, and they regulate what medical devices, especially dental or including dental, we can and can't use in Australia. And I have come across implants and other components which are not TGA approved in Australia, and therefore I'm unable to get the components to maintain or fix or restore some of these issues that some of these people have had, which are from overseas. And I have a case going on at the moment where she's got some failing implants which are going to have to be surgically removed. She will lose bone as a result of it, and she wishes she never got it done overseas. So some practical things to think about there, and hopefully some real actionable steps. Let's go to the next slide, Michelle, if we can.
Yeah, can I just a
Yeah,
question
no.
just come through, Les?
Okay.
And the question is, how can I tell if a dental practice overseas is clean? Now, great question.
Oh, the
Because
stories.
I mean, we know that in Australia we have one of the strictest hygiene and infection control standards in the world, in our dental practices and medical facilities. And you know that puts us as patients in the position where we're protected. So when you go overseas, you know, if you have to go to another dental practice, or you know, you find yourself in a situation where you have no other choice, how do you know what are you going to look out for?
That's a great question. It's an excellent question. And first of all, it's good to highlight that there are different regulations in different countries, and they vary widely, unfortunately, which means what's good in one country is unacceptable in another, particularly developing countries. Um, you know, we like to complain in Australia that due to the bureaucracy, there's so much paperwork and red tape, it's not funny. But ultimately, that's there to protect the public, and you know that's always a good thing. Um, I can spend a lot of time on this question, but I'll try to. Once again, I'm promising to give some practical tips. Now, what I suppose one of the first things that I would do if I was overseas is I would want to ask them if they sterilize their equipment on site. Because if they don't have a sterilizer on site, and the proper word for that's an autoclave, then they're probably not sterilizing everything. And that would be the first thing. And I would go so far as to say, oh, when you come in, you ask to do a little tour of the practice, if that's okay. And if they're hesitant to show it to you or to show you around, beware that there's a possibility that they could be hiding something, or not wanting to show you what's not there. And then when it comes to little things, you would want to make sure that if they're going to give you a needle, you'd want to see them set that up in front of you and it's all looking brand new and not already set up or sort of half potentially used. I would be looking to watch that they do wash their hands or use the alcohol-based hand rub prior to putting their gloves on. And I would be looking at when they get the instruments out. In Australia, you'll notice most practices will pre-bag them or will open the bags just before the patients come in, and will track the sterilization cycles for each of those bags. So it would be worth just seeing how the instruments are being presented in the clinic when you walked in. Obviously, there's some other general cues like the general cleanliness and how things are presented and things like that. So I'm hoping there's some real just practical things you can literally take with you tomorrow and utilize.
Yeah, they're really good tips, Les. Absolutely.
Yeah. Okay. How to prepare. Aha. So we've got some real life stories, and how do we prevent these real life stories? And the big moral is that there are always, or some actually, usually the emergency is a little bit preventable. Usually, that's my experience with dental emergencies, and less usual or more rarely, it is an unpreventable emergency, like a child. I say child because usually children jumping in the swimming pool, not putting their hands in front of them and breaking that tooth. And we can talk about that later if anybody wants to. But the vast majority are preventable to some degree. And having that dental checkup in a timely manner, and timely manner sort of means that can be a double-edged sword, that one. So we want to do it close to when you're traveling so that you've got a nice big tick and a clean bill of health. But we also don't want to do it the day before, because if there is treatment that's needed, then there's no time to fix or prevent a problem from becoming a bigger problem. So you'll notice I put in there at least 1 month. Obviously, the more time, the better, up to a degree, 1 to 2 months. But you'd want to try to give some time to get anything that needs to be done rather than the day or the week before. I put that one, that was so worthy to be on its own because it's the most actionable and preventable thing that everybody on this call can action. If we go to the next slide, Michelle, we'll see that I've put a few other things, which are some lessons that have been learned over the last 30 years. I still left the checkup up the top there, not ignoring the niggles or the discomfort. Now, the issue is somebody might say, oh, I went to the dentist 3 or 4 months ago and I had my teeth checked and clean. Well, that can happen in 3 or 4 months. If there is a pain or a niggle, my suggestion is, especially if you're traveling, not to ignore it. I have put in there sometimes we can prepare for the worst with a prescription. Now, we don't like giving antibiotics unless there's an obvious infection that we're treating, so we can give the right antibiotics for the right person for the right infection. But there is the rare occasion where there is something there that we can see that some sort of preventive prescription is worthwhile holding on to keep you out of trouble, especially if you're traveling in a remote part of the world where medical attention is hard to come by. Being mindful when you're on holidays, don't use your teeth as tools. We see this very commonly. And unfortunately, we're away. We don't have our kitchen drawer with our trusty scissors or knives, and we go and buy that packet of chips that we try to open with our teeth and break that front tooth. So avoid that. The pocket knife. No, we're not allowed to carry them on our luggage on the plane anymore, but put it in the luggage that goes in the back of the plane. And I always say, try to get one with a pair of scissors because that'll get you far away and it'll save your teeth. Now, watching what you eat, the first one I got there, cold chocolate. That's nearly the most common problem. People buy chocolate, they're overseas, you're in Switzerland, you'll buy the Swiss chocolate. They tell you to put it in the fridge because it tastes nicer. Or in the case, if you're in the snow, you might leave it out the window in the snow. The hard nuts is a common one. The olives and seeds, especially the Mediterranean places, they just put the whole olives in there. They don't necessarily pit them. Or if they do pit them, don't guarantee that they'll be 100% pitted. So that's one to be careful of. And I've had a few experiences with myself and people. I've got a story where I was in Fiji and I was hungry as ever. And there was this beautiful looking chicken curry. It was at a buffet, and I put a beautiful big plate. I'll never forget the first spoonful I took, and all the bones were still in the chicken. I didn't break a tooth, thank God. But there's a lesson there that when you're doing things you don't normally do, like when you're on holidays, you just got to be a bit more careful. And the last thing yes.
Can I confess to this one?
Yes.
I ate cold chocolate from the fridge, and it was a big block of Cadbury chocolate. Of course, I couldn't break it with my hands. So I thought I'll just bite one corner off, and it actually twisted my tooth.
Yes. It can be very hard. It can be very.
I was just trying to have a sneaky piece of chocolate, and I regretted it the minute that I did it.
So good to be mindful of all those things that we don't normally do. And we all know we're on holiday, we tend to do things that we may not have done when we're at home. Now, the last one's preparing by having your own dental emergency kit. Let's go to the next slide, Michelle. We'll see the list of things that I thought are good to take with you. Now, the first thing I put in there is gloves. Obviously, some disposable gloves. Usually when these things happen, we're not really expecting them, especially the true emergencies. And unfortunately, it may be a loved one, not your own, or it might be a stranger. Having a pair of gloves which fit you can save a lot of angst as to, do I help, and to what degree do I help? Because if you've got that protection, well, that's one line against blood-borne diseases, and saliva can carry a lot of bugs in it as well. So that's a good first thing to have in there. And if you have the opportunity to have different sizes in case it's for somebody else, it's always a good thing. Gauze are those little sort of cotton sheets that you see. That's an important ingredient in this kit to have in case someone has had some trauma and they're bleeding, and you can roll that up in a little ball or like a little pad, ask them to bite on it or hold it in position with their finger, and that will help stop bleeding. Antiseptic gel or wash, they do come in gels or mouthwashes. it's the antibacterial component that's the main one. And although they all have them, one of the best ones is chlorhexidine, and that's in a couple of different products. I did write a blog on this. I mentioned Savicol. I don't usually like mentioning brands, but there's so many brands of mouthwash and these gels out there. It's confusing for the best of us. So the most I'm going to use the word famous to Colgate make a product called Savicol, or there's another product that's called Difflam, and Difflam has the benefit of having an anti-inflammatory in it, which means it'll help with pain relief as well. Um, and once again, they're on the blogs. I think, Michelle, you'll be able to leave some notes with our website maybe,
Yes,
and
I'll be
people
able to drop our
access the blog.
website into the chat. Yes.
Okay, excellent, in the chat. Pain relief. Pain relief, you never need it until you need it, right? And when you need it, you want it on hand. So, the classic two are the Panadol and the Nurofen, and we can talk about that later if anybody has any questions about that. Wax or gum. So these are the things that you need when something does break and it's sharp and you need to cover it up because it will cut your tongue or your cheek. A good old beeswax will do the job. You can get something we call orthodontic wax. Most dentists will be able to provide you with that, or your orthodontist if you've got braces. And I've put gum there as well. If all else fails, don't just remember, get some sugar-free, of course, because we don't want to cause any cavities. But some gum can be chewed up and it can act as a good little pad over a broken tooth to help protect your tongue. Toothbrush and floss. There used to be a show on TV many years ago, Don't Forget Your Toothbrush, because I think it was one of the most common things that would be forgotten when people packed. And it's also always easy to get a good one on the other side of the world. So putting that in there, important to keep things clean, hygienic. Even if there is some trauma, usually brushing lightly is much better than not brushing at all. So having those in there is, I think, nearly self-explanatory. Small container with lid. Now, when I first wrote this, some people asked, why would I need a small container with lid? But you were smart enough, Michelle, to go, I know what that one's for. Should a tooth get knocked out or a bit break off, you really want a container to keep it in so that you've got it. Now, there's a good chance the dentist may not be able to use it or may be able to use it depending on what's going on. And keeping it stored clean and safe so it doesn't get further damage is really important. While we're on that, storing it, usually the easiest thing to get is some milk. So if you do have a knocked out tooth or you do have a broken bit of a tooth, small container, put some fresh milk in it, seal it up, and then keep that until you get to see your trusty dentist. Now, the dental mirror is not the most crucial thing to have in this kit, but I've put it in there because it can help sometimes. Now, you don't need the beautiful stainless steel front surface mirrors we have in the dental clinics. You can get some disposable ones. I've seen them in chemists. And if all else fails, contact us. We could probably get hold of some single-use mirrors which we can distribute if anybody really wants one. But give us some time to get them because it's not something we normally have. So there we have 1, 2, 3, 4, 5, 6, 7, 8 items. They're the main ones. And I think that's a good little summary of things to be wary of and ways of preventing your dental emergency the next time you travel. The key point, come in, give us enough time to sort stuff out before you go. And if you are over there, don't be afraid to communicate with us.
Yeah, absolutely. What a great list. And if everybody who's watching, I would encourage you to just grab your phone, take a quick photo of that so that you've got it handy, when you're at the shops kind of doing your pre-holiday stock up of things that you might need there. And that's a really good list. Les, there's a couple of questions that have come through while you were talking, and I didn't want to interrupt you. One of the questions was, what is the best painkillers to take? So, we've obviously got the choice nowadays, I guess, with, we've got Panadol, we've got Nurofen. Is there anything else, or which one would you kind of recommend over those?
Another good question that is patient specific. So once again, the disclaimer, this is general advice, not specific to your situation. And once again, adding on to that, it would be irresponsible of me to not say it depends on your medical history. It depends on other medications that you take. And without me knowing those things, this is real general advice, but usually the good old Panadol, paracetamol, or ibuprofen, which the brand name is Nurofen, and a combination of them can be very strong as well. Now, most dental pain is inflammatory in origin, okay? And as a result, Nurofen tends to be one of the ones that works the best, but it can have side effects. It can upset stomachs. So once again, just be mindful of those things before you just take that as some personal advice. And as a second line, if Nurofen was out of the cards, then I would say, look, Panadol is probably the next best one to pick up, that you shouldn't have a problem traveling. Also, obviously, be aware of the country you're traveling to and make sure whatever you're packing is going to be safe to take into that country.
Yeah, that's a good point. And I think also it's always a good idea to, if you've had that medication before, so don't just buy something that you've never had before and then take that, while you're overseas. It's always good to have something that that you personally, or your family or whatever who is going with you on holidays, has actually taken that medication before. And yes, you're right. Read the label on the pack. While you're in the pharmacy, kind of stocking up on things to take overseas. Pharmacists are always very friendly, I find, and they're more than happy to to chat with you about the medications that you might be on and those types of things. So that is good, sensible advice. So we are happy to take any other questions. I'm going to stop sharing the screen now so that we can see you. Now, there's a couple of other questions that have come through. If a person needs to go to the dentist overseas, in another country, if it's kind of complex treatment, what do they then do? Would you be advised to kind of go through with that treatment? What if there's something really wrong and you've got to kind of figure out what you do when you're over there?
Okay, that's a really good question, and it's something that actually happens. It's not a far-fetched question. It's something we've helped many people with. Usually, there are procedures that can be done, which will, I'm going to use the word provisionalize or temporize a situation, or get somebody in what we call a holding pattern, so they're safe and they're comfortable until they can return home and get that complex treatment done at home. Now, usually, okay, I'm thinking of specific examples. One example is root canal therapy. A toothache may lead to the need for root canal therapy, and there are things we call dressings that can be done in place, which can last for up to months. And if it were my tooth and I didn't know I was in another country, obviously you want to get out of pain, have a dressing done, and then I'd probably wait until I returned home to go and see somebody that I knew with that. And then there are other things like, for example, if a tooth is removed or needing to be removed for a particular reason, so be it, but don't be in a hurry to put an implant in on that same day or while you're on holidays, because usually if it's been due to trauma or infection, it might be good to let that heal up. And there is always a window of opportunity, and that window of opportunity is a good 6 months. It's not 1 or 2 days or 1 or 2 weeks. So if someone sort of pressures you to do something quickly or else, just feel free to email us as well. Our email, hello@definedental. And especially, I understand most of the people on this call are people who have visited us before. So give us a bell, send us the email, and we will be able to, number one, send x-rays to the treating dentist, or number two, receive x-rays from them. And then as a result, we can give you advice and we can communicate, we can act on your behalf when talking or discussing what we think is best with the dentist at the other end. Indeed, I've done that multiple times, and the patients usually get the best outcome there, because, hey, you're getting two sets of eyes having a look and two opinions, and if we can agree, that's probably a good thing. And things can be done exactly the way is best.
Yeah, and what a relief to know that, you care about your patients that much to go out of your way to kind of help them when they're in distress really in another country. I think that is a great service that you provide, and it just goes to show how much you and your team care about everybody.
And before I forget, beware of time zones. So clearly, if you're in Europe, it might be midnight when you send the email. The email won't be monitored at midnight or 1 or 2 in the morning. But rest assured, when we get into work, we will check them.
Yeah, absolutely. Absolutely. No, that's really good information. Now, if you do break a tooth, if you do, have that chocolate like I did, and in my case, it twisted a bit, but if it did break, if your kids are swimming in those lovely pools in Fiji or overseas, and they accidentally kind of knock their tooth, and it comes out, or it gets chipped, what's the best thing to do then?
Okay, that's a question we give 1 week's worth of lectures on in itself. The trauma to the mouth and teeth can be categorized in many different ways according to how severe the damage is as a result of the trauma. So I'll just try to cover a couple of main scenarios. And the worst is always a knock and a tooth comes out or is displaced. The advice there is, if it did come out and fall on the ground and it's a little bit dirty, you really want to clean the dirt off. Hopefully that didn't happen and you have it still in place or in your mouth. Reposition it. Let me just clarify, this is for adult teeth. You would never do this with a baby tooth because you don't want to damage the adult tooth that's hopefully underneath it. So just get it back into position. Use your bite as a guide. And then you want to try to hold it there. Usually it will go back, it'll be loose, but it'll sort of sit there. And if it doesn't, try to get hold of some aluminium foil or something like that and use the aluminium foil as like a mouth guard, and that'll just help let it sit in position. If the tooth's been knocked and didn't fall out, but you can feel it's been moved, maybe try to push it back to where it should be. And that can require some force. And if it's too painful or requiring too much force, then you might need to get a dentist to help you with that. The next sort of severity is when a tooth breaks, and that what we do with that is probably beyond the scope of this chat, but my advice would be keep the piece, put it in that little container with a lid, put in some milk, that'll keep it safe. And if the tooth is very sharp, put something like the wax that we mentioned or some sugar-free chewing gum to cover it so you don't cut your tongue. And by covering it with something like that, it'll also help protect it so it's not as sensitive when you do, and we all have to eat and drink, so it'll help with that as well. So that's some general information on some quick things to do. Yeah.
Well, that's really good, very good advice. If you were to take antibiotics with you overseas, are you able to actually do that? Do you know?
Yeah, okay. In the past, what we've done, and it depends on a couple of things, but we would want to see the person before. I wouldn't just prescribe someone antibiotics over the phone without seeing them. We'd want to see what the issue is or what the potential issue is, because that will not only dictate whether they should have treatment before or not, it'll also probably dictate what we suspect the problem to be, which will dictate which antibiotics. And usually it would be prescribed here in Australia, and that would be procured here at a chemist in Australia, and they would just take that with them. And whether or not they take it on their onboard luggage or, carry on or checked, or whether they declare it at their port, then I would say, yeah, I would just declare it, make it clear, and usually they're fine at most countries.
Yeah, sure. No,
I
that's
haven't had anybody have a problem with that. I just say do those things.
Yep, absolutely. Fantastic. I think that is all the questions that we have. Thank you very much for everybody who has joined us this evening. I've dropped a link to the Define Dental website in the chat. You're welcome to click on that link, go to the website. There's a booking link if you do have a holiday planned and you want to make an appointment prior to those holidays. I think we're about 8 weeks out until Christmas. So, you're welcome to kind of do that now, get in early, make sure you're getting all of your treatment that you need to set you up for a great holiday. Also on that website is some links to some blog posts which Les writes. So please go in there and have a look at that as well. Les, do you have any final words of wisdom so that everybody who's on the call, has a great holiday and doesn't have to worry about these dental emergencies?
Great words of wisdom. We've all heard that cliche, prevention is much better than cure. So book in, let's check it all out, and let's give you the big tick of approval before you travel. And not only will it'll give you a peace of mind. Hey, I've had it checked. We know everything's all right. Great. And that's one less thing you have to worry about, making
Yeah.
your holiday that much better.
Absolutely, that's great advice. And prevention is also the more cost-effective way as well. I know. So, yeah, no, that's really good. We have a little comment here. Thank you, Les and Michelle. Very informative. Have already bought my dental wax for my upcoming holiday. Well done.
Well done.
Kit. No, that's really good. Fantastic. Well, thank you very much, everybody, for joining us this evening. Les, thank you for your words of wisdom. I'm sure we can all go on holidays after we get checked out and have our dental kit ready, knowing that we're going to have a great holiday and we've done everything that we can in our power to be able to avoid any dental emergencies. So your words of wisdom always very welcome, and it's been great advice. Thank you so much.
Thank you. And thank you, Michelle. Hopefully I've offered some value to everyone who's looking at doing some travels, and we can just make them that little bit better.
Absolutely. Thank you so much for joining us. Have a great evening, and we look forward to seeing you in the clinic soon. Bye, everyone.